So what are my thoughts on garments after surgery? That's one that I've gone back and forth with because garments are very important, I think, but the timing of when to use them is also critical. Now, for things like breast surgery, I think it's important to put garments on right away because they provide support for implants, for example. But it's important that the garment not be too tight. That's a very critical thing, especially in body contouring. In the beginning, the early stages of my career, I used to put patients in garments right away, right after surgery. But what I found is that patients would then continue to swell over the course of 2 to 3 days. And sometimes the garments would then become too tight in the immediate postoperative period. And they would either fold over on themselves, create marks or dents, and sometimes those could be very severe. So now I think garments are important, but I wait a few days till after the surgery before putting the patients in the garments, because by then some of the swelling has already started to subside, and we can then measure the patients and find the perfect garment that fits them. Sometimes I'll have garments custom made so that we know that they will fit the patient perfectly, because it's important to have a garment for support, but it's critical that the garment not be too tight. So timing of garments is, I think, the key question, when to start them. And then, of course, following the patient through the different stages, because the garment that you use right after surgery is not the garment that they're going to need 2 to 3 weeks out from surgery. So it's important to tailor the garment situation to every patient on an individual basis. Thanks for tuning in to Body by Polly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.